Hi everybody, Dr. Isiorho, Dr. I from Corrective Health Center in Tigard, Oregon. You're seeing me, so that means we have a foot and a procedure. This is an angry toe. And what makes it so angry? You see how red it is? You see how large that inflammation is? And you see just how that nail's digging in, and you can even see some reactive tissue changes. So that's basically chronic inflammation. And unfortunately, this has been going on almost for 5-6 months, it sounds like. So our patient's nice and numb. We've painted it with betadine. That's why it has this brownish, orangish, greenish tinge to it. So let's have some fun. So we're going to do a partial border removal. So partial border means I'm just going to take out this third. We call that the medial. We call this the lateral. I'm just going to take out this lateral third. So I'm freeing up the edges on a close near nail bed. Then I'm flipping it over. I'm going on the bottom. And this is my favorite part because you can always see how much of that is buried inside the nail, inside the toe. So you can see how much of that was actually underneath. So now that we have that out, we can actually resect it.
You're going to feel so much better. How are you doing? Okay?
You okay? All right. So that portion of the nail is gone. You can see that part that's bloody was definitely exposed, but this entire section right there was actually diving deep, and that's why I like to call it the iceberg effect, because it looks like there's a lot, but it's like an iceberg. There's always more underneath. So now we're going to clean and see what else is underneath there, if anything else is there, because as you recall, this part was really inflamed, so we're going to see if there was any kind of pus. And I didn't see any pus, so that's good. So it's just angry and inflamed chronically. And that's what your nail is going to look like when it's all said and done. So now we're going to score that matrix area. This is where the nail actually grows in right here. So you may feel or hear something. But this is what helps us to cauterize or basically burn the nail root so it doesn't grow back. And what we're doing is we're doing a permanent procedure right here. So we're actually going to put some chemicals back there, sodium hydroxide and acetic acid, to basically cauterize that nail and then reverse the cauterization. And just that. So now that's good and scored. We have our medication, and if you listen carefully, you might even hear some sizzle. Okay. Oh, I love my job.
You doing okay? He's like, yeah.
This is the part where I usually cover it up, but it's unfortunate for the cameras. So we're gonna give you some more. Can you pause it for a second?
I can.
Now we're gonna reverse it. Breathe. Nice, good breath. There you go. There you go. So what kind of drone footage are you editing tomorrow?
Like we filmed a short film for class.
Subject matter.
Just we could choose whatever we wanted to do, and we chose to do like an action film where I get mugged and I have to chase down the mugger.
Can you give any spoilers away? Did you catch him or?
Yeah, I catch him in the end, and
okay.
yeah, it took us a while, and I almost passed out running so much. We had to do quite a few takes.
I'm sure the directors weren't teasing you with that. All right.
Yeah.
So we're done with the procedure. We're going to start dressing the toe up right now. So again, this is what the toe is going to look like when it's all said and done. We're going to put a big dressing of antibiotic ointment and non-adherent dressing, and of course gauze to collect any bleeding. So you're going to leave this dressing alone for 24 hours, give or take, a minimum of 8 hours. After that, you want to soak it off. After you soak it off, you can pull it off. You're going to see how I ravel this on. You can pull it off underwater, or you can just kind of kick it off in the morning whenever you shower. Okay. After you remove this dressing, you want to make sure you use some antibiotic ointment. You want to use antibiotic soap and clean it. And then after you clean it, you want to pat dry it. You don't want to rub it because that's going to be raw skin and that's not going to feel good. After you pat dry it, Then using antibiotic ointment, Neosporin, Polysporin, Bacitracin, or petroleum jelly. I like petroleum jelly. And then a Band-Aid or 2. You want to change this dressing twice a day. So if you shower daily, that's one soaking. And then you'll do another soaking with Epsom salt and lukewarm water. You're going to do that for the next 5 days. So today is Thursday. So next week, Tuesday, you're going to stop soaking this twice a day. Next week, Tuesday, you'll stop using antibiotic ointment. And next week, Tuesday, you'll stop using a dressing for 24 hours. So that means whether it's during the daytime or nighttime, you leave it open so it'll start to dry out. And that's what gets that healing process. And that's what a lot of people mess up is they keep doing one of those things and that keeps the wound open. So if you do that, we'll see you back in 2 weeks and we'll take care of you.
All right. Thank you.
Till next time, take care. Dr. Cheryl signing off.